So, good afternoon. We are going to start again with the last item on the agenda of today's ENVI meeting, and that is the hearing of the candidate for the function of the Director of the European Centre for Disease Prevention and Control, ECDC. And we're very happy and honored to have Dr. Pamela Rendi-Wagner. Thank you very much. I think everyone has read your CV and everything. So, but I'm also sure people will have questions, because I think ECDC was not the best known institution 5 years ago of Europe, but that changed, of course, drastically during the corona pandemic. And I think everyone has seen the importance of ECDC and got also a lot of political attention afterwards. But now we need to move on, and maybe the corona pandemic has moved on slightly. That doesn't mean that the topic is deserving not less attention, so to say. So what we're going to do is we're going to give you the floor for an introduction. That will be for 10 to 12 minutes. Then we have the ENVI contact person for the ECDC, who we will give the floor first. And then for each political group, we have spokespersons. And then, of course, there's also a possibility for catch the eye of members that would like to ask a question. I would ask those members who would like to ask a question, just raise your hand so that we can take note of the catch the eye. So without further ado, Dr. Pamela Rendi-Wagner, I give you the floor.
Thank you, Chair. Distinguished members of the committee, I'm very happy to outline my visions for the ECDC today here in times of new responsibilities and new developments. COVID-19 has literally moved public health into the center of public awareness, and this was a decisive moment for all of us and all our societies. And during this time, the ECDC has played an important and eminent role by providing accurate epidemiological data, prompt risk assessments, and by giving reliable support for decision-making at the European as well as on the member states level. And by doing this, the ECDC helped the health authorities in difficult times to make quick and, most importantly, evidence-based decisions, and to strengthen also European cooperation and to learn from each other. Well, and looking back at this hard time and pandemic years, with all the enormous burden for our health systems and burden for our societies, we have to say that at the same time we were able to identify gaps regarding our preparedness and to assess what worked and what didn't work. And in the light of these lessons learned, a new legislation, as you know, for a new European Health Union was adopted. And at least to my impression, this was an incredible fast response of European health politics, including this committee, with a new EU health security framework. And this legal framework was a decisive step. It was an important step in the right direction, and it comprises a reinforced mandate of the ECDC and EMA and a new regulation on serious cross-border health threats. And both of these new regulations or mandates have implication for preparedness far beyond COVID-19. And these implications are the strategic outlines for the ECDC's work the next months and years. And the strategic outline for ECDC's work can be clustered in 3 main strategic points. First, implementation. Second, prioritization. And third, cooperation, including communication. First point, implementation. Well, regarding the implementation of the reinforced mandate and the regulations on cross-border health threats, and based on the work which has been done already in the last months and years at the ECDC, the following objectives need to be addressed. ECDC's support for the member states in preparedness and capacity building needs to be intensified with a new permanent health task force and so-called Article 8 are assessments of the member states. And these two are the core tools to improve preparedness and response in the member states in the future. A further objective is to improve effectiveness of digitalized and integrated infectious disease surveillance and capacity building in the member states. And as you know, there's a pilot project on e-health-based surveillance, which has already started some months ago. Moreover, foresight and modeling of long-term scenarios need to be applied. And in addition, the partnerships with other European agencies, international organizations, and also globally need to be strengthened. And finally, the low vaccination rates in Europe need to be increased and an ongoing monitoring of vaccine effectiveness and safety ensured. And the overall aim is a stronger European health union that is fit to better anticipate, prepare, and respond to all future health threats of all kinds, not only emergencies and outbreaks of infectious diseases. No, it's about the emergency of new pathogens. It's about the fight against AMR and vaccine-preventable diseases. Second strategic point is prioritization. Well, in line with the new mandate and having in mind current and future health threats, the working priorities for ECDC for 2024 and beyond, of course, reflect to a large extent the areas of this new mission I've just outlined. But the pandemic also reminded us on the importance of One Health approach as a guiding principle in all activities, public health activities, including preparedness. This crucial point was also stressed in your resolution only last year called Lessons Learned and Recommendations for the Future, a very important point. Moreover, since antimicrobial resistance is still at an unfortunately high level in Europe, activities for the prevention of AMR and also health-associated infections are crucial. And it is important to support the Member States and the Commission in reaching the Sustainable Development Goal on HIV, TB, and hepatitis, since all of these infections are still main global health threats. Third point, cooperation and communication. Our experiences during the pandemic years also highlighted the importance of a robust and trustful cooperation between the Member States and the Commission, the European Parliament, and other institutions, such as WHO, to improve a coordinated common action, to avoid unnecessary duplication, to create best synergy of work. And this cooperation is crucial for a successful crisis management in the future. And what I strongly want to emphasize is the utmost importance to restore trust. To restore trust in science. Being a scientist myself and a medical doctor, this is very important from my point of view. To restore trust in independent public institutions such as the ECDC, as we are facing more and more science skepticism in the population and also fake news. A trustworthy communication is essential via traditional and via social media. The need for cooperation and communication is a task we are all facing. The ECDC, the European Commission, the Member States, and the European Parliament, with the ECDC as the core institution providing scientific-based evidence and arguments. We need arguments for good communication. Next year, we'll be celebrating 20 years of ECDC. So it's time. It's time that European people not only know and value, but most importantly, trust this leading health agency. It's time to anchor the valuable work of ECDC in the consciousness of the European population and to strengthen trust in science and public institutions of the European Union. Dear Chair and distinguished committee members, public health has always been a key subject through my entire personal career. And as a young doctor working in different parts of the world, I soon realized that classic medicine is important, of course, but the impact of action in public health is much, much higher. And as a doctor, you can maybe treat 50 patients a day from the bedside, but at the level of the European Union, public health means responsibly working for the health of 500 million people. Dear members of the committee, I want to contribute with my broad working experience to further strengthen the important role of ECDC as one of the main European health agencies in our common fight against future health threats. Thanks a lot for your attention.
Thank you very much. And now we will go to the exchange of view. We will do it each time with a direct question and answer format. So that means that the people can have a question, and then you will have, most of the time, 2 minutes sort of to answer to the question. And first we're going to do that, of course, with our ENVI contact person, Madam Kopczynska. Great to see you, and you have the floor first.
I will speak Polish. Thank you. Dziękuję, panie przewodniczący.
Thank you, Chair. I'd like to welcome you. In your prior role as Director General for Public Health Issues and Head of Medical Affairs at the Austrian Health Ministry meant that you were responsible for preparing for the pandemic. This means you have a large amount of experience when it comes to contagious diseases and vaccines. So I am fully convinced that you are well prepared for your post. I'd like to say that in today's meeting, when we speak with the Commission, we can see that since you've said that since 2002, you've increased the ECDC's mandate when it comes to preparing for the pandemic. And I recall one of the reports from the ECDC that in the end was one of the packages that led to the greatest consensus in the Health Union for All. And we spoke of perhaps expanding the mandate of the agency. After the work carried out in that report, there was also a mention of the large numbers of responsibilities that the agency has, seeing as since the ECDC provides support to the member states, helps them in taking concrete steps, and also helps in preventing contagious diseases and what has to be done during a crisis as well as preparing for crises. You speak of having new dialogue when it comes to global security. And regarding to what you said, we know what your plans are, but my question is the following. As someone who will be heading the ECDC over the next 5 years, would you be willing to make us participate in your actions, and how do you foresee this more wide-ranging mandate when it comes to cooperating with the member states, when it comes to focusing on preventing contagious diseases? I would like to know how you intend to continue the role of the ECDC when it comes to preparing for pandemics at the European scale. And I'd also like to say that as head of the agency, you're going to have to overcome challenges such as expanding the agency as well as greater international cooperation. So I would like to know how you will prepare the preparatory documents 2014 to 2020 and the strategies that lie therein. And I also have a question on the EU for Health program. We've seen what was mentioned at the last meeting in Strasbourg when you mentioned the decisions of the European Council as to how we can how there'll be 1 billion euros less for this program, which is a difficult situation. There is a proposed initiative that aims to boost regional and national programs, and I'd like to know, in that vein, if the agency can perhaps prepare a preliminary opinion or can prepare us for how that reduction in funds will have an impact on the activities of the agency. Sorry for my very long questions, and thank you once again for being here, and good luck to you.
Thanks a lot for your questions. And I want to extend my thank you also to you as an MEP who is so engaged and so active, has been in the past as a rapporteur for the debating and discussing negotiating the extension of the ECDC's mandate. Thank you for your engagement. But I have only 2 minutes, so I have to be quick. You asked about the extension of the ECDC's mandate. Well, the mandate, as I said also before, was a consequence of the lessons learned together with the new serious cross-border health threats regulation. And to my mind, these two are the necessary tools, what we need for a fitter European Health Union to respond, to prepare better, to respond better in a joint action. And most importantly, and so I interpreted it, it allows the ECDC to take a stronger role when it comes to the support of the member states. And we have to live this in the upcoming 5 years, supporting the member states in improving the preparedness, supporting the member states when it comes to improvement of surveillance, because we realized how important data is. We learned this also during the pandemic, and to improve cooperation between the member states, between the institutions, and internationally, globally. This is very important, and these new tools are important because we need it not only for upcoming pandemics, which will be maybe more in the future because the pandemic drivers are increasing, this is for sure. We need it for new pathogens, for AMR, for vaccine-preventable diseases. So I will continue this cooperation, of course, and I will deepen also the international cooperation because we need it when it comes to climate change as a driver for infectious disease epidemiology. We need cooperations with other CDCs, Center for Disease Controls overseas, in the United States, in Canada, in Africa. And this has to be deepened for the exchange of experiences and opinions. And your last question is the budgetary question regarding the EU for Health budget. And I'm aware of the cut which was topic last week of 1 billion euros of the health budget. And we have to say that the EU for Health budget with 5 billion was one of the biggest funds, health funds, for in the history of the last decades, maybe. And I'm aware of this, but at this time of point, I cannot give you an answer on this precise impact on the work of ECDC. And because I've not started my work in Stockholm yet, so I need to look into this. And then when we have more clear data, we need to discuss this with the Commission. And what I can tell you right now, of course, I would advocate always for public health to be high up at the agenda. But I want, when we talk about budget, I also want to acknowledge that the budget for the European Centre for Disease Control during the pandemic has enormously, significantly increased from about 50 million to more than 90 million now. And this is important money because we need to, according to the extended mandate, there is a lot more work to do at this very important health agency.
Thank you. We took a bit more time for the first question also. For, no worries, it also on the question side, so also on the answer side. But I would ask the colleagues now to keep the question to 2 minutes so that you can also reply in 2 minutes. First, from the biggest political group in the parliament, the EPP, Peter Liese.
Thank you, Chair. And I will also speak in my mother tongue because it's the mother tongue of the candidate also.
She will understand, I think.
Yeah, ganz herzlich.
Thank you very much, Mrs. Rendi-Wagner, for your presentation. Now, you have mentioned the pandemic just a brief remark. Our colleague Eckert from Hirschfeld said during the pandemic that studying biology, public health, hygiene, these were boring fields of study. No one was interested in them. But then everyone saw how important they were during the pandemic and how they could have that kind of professional training and consider it useful. So we've managed the pandemic fairly well. I think we could have paid more attention to the situation with the children and keep there being less spread among children. But I think that would have saved more human lives with fewer side effects. But anyways, I have two questions. Firstly, you mentioned vaccination. Unfortunately, during the pandemic, we learned that there are some people who are really militant opponents to vaccination. And of course, this worries people who are more in the middle on the topic. So what is your strategy? We can't address the militant anti-vaccine people, but what about the people who are undecided? How are we going to influence them to accept vaccines so we have better protection? Second question, this concerns AMR. Now, today, before you arrived, we have made some broad-reaching decisions. For example, new incentives for developing antibiotics. It was very controversial. That's why we had such a discussion about. However, what we didn't discuss very much, which was very important, was the prudent use of antibiotics. And that is something where the ECDC plays a role, also in the area of hygiene. So do you have a few words about how we can deal with the 50,000 people who die because of AMR every year? How could we better address that problem?
Ja, vielen Dank.
Thank you very much.
English, aber vielen Dank für die Frage.
Thank you for the question nonetheless.
Actually, vaccination and the trust in vaccines is of highest importance, and it has been a key subject also when I was a public health scientist back at the Medical University in Vienna. And it's important to know about the reasons, and you ask also what is the reason also for this vaccine hesitancy. And first of all, it's a mistrust. It's a mistrust in science, it's a mistrust into public institutions, and it's a mistrust in medicine as such. And why? Because there is more misinformation via social media, there is more fake news, and this has enormously increased during the pandemic. And secondly, and this is regardless of the pandemic, generally, the level of acceptance of a medical intervention in healthy people who get vaccinated is much, much lower than in ill people who have a disease burden. They are more likely to accept risky medical interventions than any healthy persons. And that's the problem of vaccination, so to speak, but this has nothing to do with the COVID pandemic. So where should we put the finger into to change? It's the trust. That's the core issue. So we have to restore trust to enable informed decisions in the population. And there is no one-fits-all strategy. So we have to learn regionally what are the drivers for this hesitancy, what is the problem of concern of the people, in order to give a tailored, to provide a tailored vaccination program and information campaign. Because people want information and they want to take the decision by themselves. And this must never be didactic, and it must never be industry dependent. So it has to be independent from industry, because there the mistrust is already inside. So I think it needs more communication, awareness, and I know that the ECDC is doing this for years already, providing a toolkit on communication for health professionals. And the ECDC, together with the EMA, they have an information portal on vaccination, so at least doctors know what they are talking about. And the new mandate also includes the real-life monitoring of effectiveness, and this is also very, very important. But there is no one-fits-all, and it's a very hard thing we have to do. And the second one is AMR. AMR is increasingly important because we are still at a high level, and you mentioned the 35,000 deaths per year in Europe, and what to do about prudent use. Well, you know, it's infection prevention. That's the first one. We have to prevent infection, mostly in the hospitals, hospital-acquired infections. We have to apply antimicrobial stewardship with the prudent use and the access to novel antibiotics, as you mentioned. And this works only with awareness campaigns. So we have to have awareness campaigns in place together. EMA, EFSA, the One Health approach is a very, very important strategy to be applied here, and speak with one message. Not have 5 messages, but one strong message, cross-agency, EFSA, EMA, ECDC in cooperation when it comes to the fight against AMR. And I could tell you much, much more, but unfortunately the time is far over.
Indeed, indeed. We now turn to the Social Democratic Group, Sarah Tjeras.
Thank you, boss. Welcome, director-nominated, for being here. Yes, my first question goes in line with what Peter just asked about antimicrobial resistance. And I would like to, we know this is quite the emergency for not only health, but worldwide. It can have, if we don't do anything, it can have the more damage than the 2008 global financial crisis. And considering there's a lot of stewardship to be worked on, but considering that almost 2/3 of antibiotics sold globally are used for animals raised for food, my question is, how will the ECDC enhance the One Health approach with other EU institutions, such as EFSA, ECHA, EMA, and so on, together also with member states and in areas such as agriculture, environment, to mitigate the impact of antimicrobial resistance, not only for human health, but also for animal health and the environment. My second question has to do with HIV, the 2030 targets. We're very much on the route to get these targets done. The first target, we have 88% of all people living with HIV diagnosed, 93% of all people diagnosed with HIV on antiretroviral therapy, and 92% of all people on therapy virally suppressed. However, even though there's really great progress in the EU region, there's still wide inequities observed within and between member states. And I'm very much concerned, and this was a topic that was raised when I was doing the mental health report, which was that many EU countries are now stigmatizing or discriminating people living with HIV and vulnerable groups with higher HIV prevalence. So my question is, how in your view can the ECDC plan to support and lead member states in order to achieve these targets? And my last question has to do with digitalization in health. You know, we just reached an agreement on the European Health Data Space. How do you view it as contributing to the ECDC mandate for better scientific evidence-based policies, considering that you already mentioned misinformation and disinformation, but unfortunately that's not something that stays at the doors of this parliament. So how can the ECDC also aid policymakers with better scientific evidence-based tools? Thank you.
Thank you. Madam Rendi-Wagner.
Well, thanks a lot for these very interesting issues. I'm very much committed to all of these, from AMR to HIV, and also improving digital surveillance. Well, AMR is such a broad topic because the disease burden is so big, but the disease burden is, as far as I know, 800,000 people per year alone in the European region. And there is a disease burden, but on the other side, we also have a burden of economy, which is like 11 billion per year. And this should be also a motivator for the European Union to invest more money in AMR prevention. And the worrisome thing about AMR is that the rise of multi-drug resistance, including fungal species. So this is really a worrisome development. Well, the 3 strategic points to fight AMR is still increased surveillance. And when I talk about increased surveillance, I think we have also to think about new methods and laboratory harmonization, standardization all over Europe. because this is not the case. And you spoke about variations when it comes to HIV, but this same is the case with AMR and molecular surveillance, because we really need to strengthen our capacities in molecular surveillance to find out more about resistancy in the epidemiology. So surveillance is utmost, and I know the ECDC is doing this for many, many years, EARSnet, ASACnet, and all the other networks on the epidemiology. Awareness, I mentioned already. There cannot be done enough on AMR and on the infection prevention issues and the strategic cooperation when it comes to One Health approach. And this has to be enforced, not only on the paper. We have to start living this cooperation strategically with EFSA, with the EMA, also with the Environment Agency, because there is an interconnection, of course. And the pandemic, as a zoonotic disease itself, should have reminded us, it's a wake-up call to be reminded we need a cooperation on this to also fight AMR, not only pandemic diseases. And I think the targets, the Council recommended targets on AMR are very useful. Second, the SDG, HIV, in the framework of the SDG goal, number 3, is very important. And the big problems with the monitoring and surveillance of HIV and the SDGs as such is the gaps in data. We really have gaps in data when it comes to TB, hepatitis, STIs, sexually transmitted infections, but also HIV first. And the second big problem, stigmatization. Stigmatization, why is it a problem? It's socially a problem, first of all, but medically it's a problem. Because stigmatized groups they become their diagnosis much later, which is not good. In HIV, it's never good in any patient, but in HIV it can have really problematic outcomes for the patient. And we need to ensure and enforce fast access to diagnosis, fast access to treatment, because we know that 11% of the HIV-infected people are undiagnosed, and they live approximately 3 years until they are diagnosed. This is far too long, and this is so. In this way, we will not reach the SDG goal. And third one, wow, digital is a huge topic. Digitalization, well, this is really a huge topic, because it's part of the mandate, and it's a huge part of the mandate. And the ECDC, from my point of view, should really support the member states to develop secure and interoperable digital platforms for a timely, complete and comparable surveillance data. Because this we learned in this pandemic, we need reliable data which is comparable, and this we only can get if we connect the systems. If the new eHealth data space will provide this as a good opportunity for the ECDC in future, I cannot answer yet, because we are right at the beginning and we don't know how it will work in the end, how the infrastructure will look like, what kind of data will be used by the institutions. So this I cannot answer now. In theory, this is the right way to go.
Thank you. We now turn to
Sorry for...
We now turn to the Renew Group, Catherine Amalric.
Merci. In French.
I will speak French.
Madame.
So, Mrs. Rendi-Wagner, I'd like to thank you for your presentation and all the reminders as what has been structuring the Europe of health since COVID. And I'd like to thank you for stressing how important it is to reestablish trust in science and scientific information. And I've been involved with the head of hospital services, and your reminder is essential and necessary for society and public at the scale that you mentioned. I have 3 questions. Firstly, concerns extending the surveillance of impact of transmissible diseases on non-transmissible ones, monitoring their impact, as to how serious they are, and how well they are taken on board, and chronic diseases, which are in plans, impacts would you be for extending the mandate of the center to the impact of transmissible diseases on non-transmissible diseases, especially in times of health crisis? Secondly, sanitary consequences and health consequences of the war in Ukraine. After 2 years, we are still concerned about the situation and the health consequences. Could you give us a summary of the latest assessments of the ECDC so as to how to lend our support and what strategy would be inherent to supporting Ukrainian refugees and avoid spreading transmissible diseases? Can you encourage the Commission member states to promote vaccinations against tuberculosis, against polio, diphtheria, tetanus, all sorts of diseases, and stress the importance of vaccination against these diseases to avoid their the increase thereof? Now, with respect to sexually transmissible diseases, at the beginning of the month, the center said there has been high increase of these. There's about 48% of increase in gonorrhea, 34% in syphilis, and 16% in chlamydia. So if there are ways, because there's a different way of detecting and treating sexually transmissible diseases, how can we get better harmonization among member states and improve the understanding of the policymakers? Thank you very much.
Thank you very much for the three questions. Well, the surveillance of communicable and non-communicable diseases has been debated, I guess, a lot in this ENVI Committee in the last years when it came to the extension of the mandate, I guess. And indeed, from the scientific point of view, there are strong interconnectivities between communicable and non-communicable diseases. We can talk a lot about this, but the most important is that chronic diseases can be determinants and risk factors for the epidemiology of infectious diseases, for certain infectious diseases. And second, we know carcinogenic infections. Everybody knows the hepatitis B, for example, or HPV, human papillomavirus. They are both viral-induced carcinomas, but most importantly, they are vaccine-preventable carcinomas. And this is a breakthrough, actually, from the point of view of a medical doctor, to have vaccines in hands to prevent carcinoma. So these show the strong links between communicable and non-communicable diseases. So from the scientific point of view, it makes always sense to learn more about these links and to look more into the drivers of infectious diseases. And as far as I know, the new mandate includes a next year's external evaluation of the mandate and the work of the ECDC, also I hope including this question. And I would say let's wait and see what this external evaluation will bring up on the table in the end. But it's not me to decide if the ECDC is going to extend the mandate to non-communicable diseases. In the end, it's a political decision. Second, Ukraine, and how should we care about the health of Ukrainian refugees? Well, this is very important, and I think the best is to include Ukrainian refugees as quick as possible into the national health systems, to provide them access to national health care out free of costs and free of charge, of course, so that they are looked after when it came to disease. And very good question regarding vaccination of refugees, because we had the same question when in 2015, during the huge refugee crisis in Europe, where the ECDC came up with a specialized vaccination program for the important vaccines for refugees. And I think this is a good idea. But I think Ukrainians need basically the same vaccines as any other European citizen. So integrate them into the health programs and the healthcare system of the states, and then they are well looked after. The third one was STDs. Well, the question of STDs is indeed a problematic one because they are at a rise. That's what ECDC has just presented a few weeks ago, and this is indeed worrisome. And the worries are that many or some member states don't have a reporting system for some of the SDGs in place. So we have no data available. We cannot compare. And there is no harmonization and comparability. And this makes it really very hard. I can talk a lot, but I don't have the time. What are the reasons for the rise? But I think it's necessary to look at the drivers, at the sexual behavior, which is behind the rise as well. But it's not only this, it's COVID, which has also an imprint on this epidemiology, and to have a look at national policies. We have to know why some countries have national policies and screening programs in place and who not, and we have to work on the stigmatization question, which is some very problematic one. And we have to ensure fast access to diagnosis, fast access to treatment. We have to work on new diagnostics because there is a lot going on in the medical technology, providing also home testing, new molecular diagnostics, and we have also to push more for new antibiotics when it comes to resistant STIs.
Thank you. We now turn to the Green Group. That will be me asking the question on behalf of the Greens. First of all, thank you very much for being here and also for your openness to become director of ECDC. I think it's very important, and your CV shows that you are very qualified, so there are no questions. And also, of course, being in the management board, you know ECDC. So in that sense, and that you can already tell. I think one of the biggest problems that we foresee is, of course, the relation with the member states, and certainly the discussion on to what level do we need a European agency on health, because it's quite often still regarded as a national competence. We have seen that also in the discussion of expanding the mandate of ECDC. And then there was, of course, a big pressure and a very clear case why we needed that expansion of the mandate. But we also know the member states, when there is less pressure, see that less. So I would be very much interested to hear from you also a bit on how do you see concretely your cooperation with the member states to convince them of the importance of having a strong European health agency. That brings me to the second question also with the relation with HERA, which of course has been founded as well. We had some interesting discussions on that as well here in this house. And we do not know exactly where HERA is going, but maybe HERA is going to remain as an independent agency, who knows? Then, of course, how do you see the relation and the cooperation between ECDC and HERA, and what are the differences that you would say is in the different functions of both? And that brings me to the last question, just as an example. It's on AMR. You mentioned it a couple of times, and you also mentioned then all the different European institutions that are responsible or having a role in AMR. I would be interested to hear from you specifically, how would you define the specific role of ECDC in this case of AMR vis-à-vis the other institutions like EMA, etc., who have other roles, but what's the role of ECDC in your words on AMR specifically? Thank you, and you have the floor.
Thank you for your question. Well, the first one is maybe the most, well, the broadest one, let's put it that way. Well, how do we convince member states? Because I think after this pandemic, with this burden of disease for every member state, for economy, for every individual, for societies, for health systems, for the workforce in the hospitals and in the public health arena, every member state should be convinced that public health is something we really, really need. We're not finished with public health. There are some scientists some decades ago that said we don't need public health anymore because we have vaccines and hygiene, so it's done. That's not the case. And the pandemic drivers are increasing. We have climate change, we have crises, we have wars, we have social problems, and all these are pandemic drivers. So do we need a strong ECDC? I think I have not the time really to elaborate, but that's maybe one of the core duties of a director of the ECDC, to be a strong link to the member states, not only to the European Parliament and the Commission, but also to the member states, and to convince them that a strong ECDC is a win-win situation it's a gain for the member states, not only in emergency situations, but also before and in between when it comes to AMR, because no small and even big country can fight this fight alone against these coming up pandemics or new pathogens. We need collaboration. When we collaborate, we are much more efficient, it costs less money, it costs less human lives, and these are so strong arguments they can use also on their political agenda in their home countries politically. And we should really work together. I mean, and we should make an offer also in making public communication together in the member states, not leave it to one to do it, but say we have the same opinion and together we are stronger. But this is one of the main upcoming tasks for the upcoming years. HERA, well, the relation to HERA was a consequence of lessons learned. I think at that time, at that emergency situation, it made a lot of sense because there was a gap, because it was a new thing to do, the joint procurement, the joint stockpiling, the management of the distribution among the member states and things like this. So there was no agency doing this before. So I understand the responsibility of HERA to be emergency-based, responsible for stockpiling and medical countermeasures in emergencies. But it's not so much about the structural, because there are a lot of discussions going on, where should HERA be in the future? And I think this is not the important question, the structure and the where. It's how. What are the responsibilities and roles of HERA in the future? And these need to be clarified and very clear. And the clearer the definition of the responsibility of the agency, it's not an agency, authority, the better the cooperation with the other agencies such as ECDC. If this is not clear, the cooperation will always be maybe a bit problematic. And this should not be the case because we cannot afford it. We cannot afford overlaps. We need the best synergy of work. And we cannot afford any overlaps. And AMR, we mentioned already very much so. What was the question? How specific? Do you remember?
Yeah, the role of ECDC. How you would define that compared to the
in the One Health Task Force. Exactly. I think the One Health Task Force is of utmost importance. But it's not only that they meet and drink coffee and say, yes, it's a huge problem, we have to task this together. But I think the ECDC is surveillance. I mean, surveillance of the human resistant cases is very important. And according to the new mandate, the new network also on European reference laboratories in the context of AMR surveillance makes a lot of sense. And I think this is a huge step into the right direction. And ECDC has a lot of competences in this field. And with building up this network all across Europe of harmonized laboratory standards with regard to infectious diseases and AMR, this would be a real great big step forward. But there's a long way to go still. Mm-hmm.
Thank you very much. For ECR, we already had, of course, Madam Konciewska, and I think Mr. Vondra is fine with that. So no questions further for ECR. We don't have speakers for ID and the left, so that concludes the round of the political groups. That brings us to Catch the Eye, and we have 3 requests on the table. So first, Madam, and apologies for my pronunciation, but Lukacijewska, I would say.
Or Elizabeth. Thank you so much. Let me use my mother tongue. Dziękuję bardzo Pani Dyrektor za wszystkie informacje. Nie mam wątpliwości, że będzie Pani bardzo dobrym dyrektorem.
Thank you so much for the information. I know that you're going to make an excellent director and head of ECDC. I have 3 questions for you. The center published a report with respect to the deadline of vaccinations against COVID, and from the report we can see 2 points. Firstly, hospitalization of some members and hospitalization in member states, and how the vaccination against COVID worked out. Now, in the case of new vaccines, it will depend on whether it becomes endemic. And we have to try to protect more vulnerable groups of the population. So how does the ECDC feel they can encourage European citizens to come back and get revaccinated against COVID? We are mainly taking vaccinations, the mRNA vaccinations. That's the most widely used vaccine. Now, we've seen that some that felt that the characteristics of these vaccines are not the best. So I'm wondering if we shouldn't bring another type of COVID shot to the market, which are not necessarily mRNA. And then there are certain anti-vaccine movements and people who are spreading fake news, false information, which has not been compared and fought on internet. So how do you plan on fighting this movement on that is disinformation to fight? How do you fight the lack of interest in vaccines against the young people, for the young people and young children? How can you fight against this disinterest in vaccines for contagious diseases?
The question, vaccination and vaccines, focusing on the COVID-19 vaccination. Well, you know that the safety issue is not within the mandate of the European Centre for Disease Control. It's within the mandate of the EMA. But I'm very happy that, that it was decided there will be a real-life monitoring of vaccine effectiveness and vaccine safety as a collaboration of EMA and ECDC in future. Why is that important? It's important to have this in a real-life mode, to have quick information and data if effectiveness changes or the safety, if a safety issue arrives. And if these two collaborate, these two agencies do this in collaboration, this is even more effective. And we use this information for the communication because it's all about trust. And if we have real life or real-time information on efficiency and safety, it's much easier to have evidence-based decision on vaccinations. And people trust much more when we can say this is out of this up-to-date reporting system. How should we proceed? Because I think the strategy should be to work also with the communities. Work with the communities, find trustful testimonials in the society and make them part of your campaign, because you mentioned young people. Young people, you don't reach if there's just a doctor in a white coat on the television telling that vaccination is very important. This doesn't interest anybody. At least my daughter with the age of 18 is not interested in that. But if there is some, I don't know, fashion testimonial, or for the boys more sport or testimonial, this is much more interesting. And they say, I'm vaccinated. This makes sense for you because we protect ourselves and we protect also the others, the grandparents, because they are at highest risk for COVID. We know that risk of long COVID and COVID complications, it's much higher the higher the age group. So, and you mentioned non-RNA vaccines against COVID. There are. On the market, there are non-RNA vaccines against COVID, so this is already the case. But ECDC will never, and even the EMA can give a recommendation which vaccine is the better one. This is not us to do.
Thank you very much. We now go to Henk-Jan Ormel, also of the EPP.
Thank you, Chair. Congratulations to your candidacy of becoming the new director of the European Centre for Disease Prevention and Control. I have a question the other way around than the Chair was asking. The Chair was asking you about cooperation with the member states. I would like to ask you about cooperation at global level. We have the WHO, we have the international health regulations of WHO. All member states of the European Union are also member state of WHO. The WHO has a system in place to evaluate the international health regulations. It's called SPAR and JEE, Joint External Evaluation. And the European Union is not cooperating as much as the world should like to see. So are you willing to cooperate more on the international health regulations, also to prevent double work? Because there's a lot of bureaucracy now, and doctors should cure patients and not fill in questions double and double from the European side and from the global side. So that's a question on cooperation at the global level. You also mentioned One Health, and One Health is very important, but One Health could also only be a slogan. And it is very necessary to cooperate with the veterinary sector and the environmental sector. So my question to you is, in what practical way will you shape this? Will you start structural cooperation with the veterinary and the environmental health sectors? Thank you.
Thank you very much. Rendi-Wagner.
Yeah, thanks a lot for the question on global and international cooperation. Well, we had a pandemic. A pandemic is a global incident. It's a global event. I mean, we cannot think that even as a European Union, we can tackle this alone. So we need the WHO, and we need the WHO all the time, because when it comes to influenza vaccine, you know, there are the reference laboratories of flu all over the world, which gives us the composition of the upcoming year for the upcoming influenza season. So there is a strong cooperation in the health sector already. But I agree, we need to do this also disease specifically. We have to intensify this cooperation because we cannot afford. In the light of these upcoming and increasing numbers of pandemic drivers, climate change, migration, social crisis, economic crisis, geopolitical shifts, this is all globally. So we have to cooperate with the WHO when it comes to IHR. And I agree, this is a very well elaborated regulation system, the IHR. And when it comes to SDGs, you know, also the SDGs being a UN product, so to speak, this is done by the Commission. It's monitored by the Commission, actually, and we're very committed to the health SDG number 3. And this is a strong collaboration, but also when it comes to measles, you know, because it's a global eradication goal to eradicate measles and rubella and the genital rubella syndrome I think by 20, no, there is no number mentioned anymore, but we have missed the goal for quite some time, and they are increasing. This is also a cooperation which is very, very strong. And I agree we have to enforce and strengthen this collaboration in the light of upcoming global crises and health threats. One Health approach, well, how practical I want to do it. Some question I cannot answer right now, and I'm very happy to come back here in due time, because after I worked or start my working as a director, hopefully in June, after Andrea Ammon, the acting director, has retired, I will go all into the technical bits and pieces of work. But since I haven't worked at the ECDC yet, I don't know about the technical bits and pieces right now. But I'm looking forward to take up my work. And also I'm looking forward to the transition period and the handover. And I want to say this at that point as well, and to thank the current ECDC director, Andrea Ammon, which I know for years and years. And I value her as a scientist and as a leader of this important institution. And I also want to thank you from here. Thank you.
Thank you very much. We have also Cyrus Engerer from the Social Democratic Group.
Thank you, Chair, and thank you, Ms. Rendi-Wagner, for being here with us today, and congratulations on your nomination for Executive Director of the ECDC. I'll shift to Maltese, my native tongue, since in this rare occasion that we have interpretation in Maltese today as well, so it's a good thing. statt in
I would like to continue my question in Maltese. So I'd like to continue on to what my colleague Ms. Serda said on HIV. This is an area of work where it's very important for the ECDC to know how important this is for us, to have data from all the different countries together, as well as bringing together the best practices. This is very important for human health, but also recently it was clear that the majority of European countries, when it comes to HIV and AIDS, they have to meet the U.S. Sustainable Goals for 2030s. So first of all, we need to think of HIV vaccines. We need to look at PrEP and PEP and how effective they are to lower the amount of HIV in the population. So I'd like to know from your side, from the ECDC, we'd like to know if you'll ensure that PrEP and PEP will be available and accessible to all throughout Europe, including minority groups, so that we can prevent the transmission of the virus from one person to another. And is there a new EU action plan for HIV? Will there be greater coordination with national strategies, which hopefully will meet the UN targets as well? And in this committee, we had a vote on the pharmaceutical package about an hour ago, and that was good. But as an MEP from a small member state, from a small island on the periphery of the EU, whenever we speak of health, I like to bring up that we can't have 27 pharmaceutical markets, 27 types of medicines. We need to work as one single EU, and it's important to ensure that everybody has access to medicines throughout the EU, and it should be affordable, because the reality is that it's all good and well to speak about vaccines and medicines, but the price in Italy, Germany or Spain, big countries, is not the same as the prices in small member states, something I wanted to stress. Thank you.
Thank you very much also for that plea at the end. I'll be coming from Malta. Madam Rendi-Wagner.
Well, thanks a lot. HIV was the topic. Indeed, this is really highly important that we have data from all the countries, and this is not the case. So the first step is to improve surveillance to be complete and comparable. And this is not the case yet. So as long as we don't have this is a real problem, and these gaps in data. Second, and this is very important, HIV, it's actually preventable. If we have the right prevention programs in place and it's offered and applied, it would work. And you mentioned the PrEP, the PEP, the needle exchange programs, the use of condoms and all this stuff. This is a preventable disease, not yet a vaccine preventable, I agree. This would be the ultimate goal, but it's a preventable disease if the right measures, prevention measures, would be in place. And of course, as a public health agency, the ECDC also is in favor of to improve prevention and fast access to diagnosis, fast access to treatment. This is of utmost importance. Your third question regarding medicines and the one single market for medicines. Well, this is a problem. It's very interesting. It's very important, and I know the subject very well, but I have to say it's not within the mandate of the European Centre for Disease Control, but I'm very convinced that the EMA is very much taking care of this very important topic. Thanks.
Thank you very much. And now last but certainly not least, from the Renew Group, Niels Torvalds, Finland.
Thank you, Bas, and welcome to this illustrious but for the moment scarcely populated committee. I am slightly afraid of being the party spoiler. We usually speak about transparency, and the process in which you were nominated was not transparent. It looks like a backroom deal, where you were sort of put in the first place, and then at the end of the process, somebody who is able to read in the leadership of the organization read the rules and saw that you need 3 candidates. So all of a sudden, when the process was already running towards its end, they found 2 new candidates just to fill the reglement. And it doesn't look good. Thank you.
Thank you. Madam Rendi-Wagner, yeah.
Well, thank you for your question anyway, but I'm not the right person to answer actually this question, because I'm not the one doing application processes, and so it's not me to change. I will be, and that's what I'm very happy, hopefully future director of the ECDC starting in June, and I will do my utmost to do this job to my best, on my best feelings, and I'm convinced we can do this together. And this is the process as such is not me to judge. It's you're MEP, and you can for sure make comments on that, but I cannot answer or comment it because it's not me to do that.
Thank you very much. It's good that you mentioned that, but indeed that's in the end also, of course, on the procedures that ECDC had in place. That brings us now to the final part, which is your closing remarks. So you have 3 minutes for your closing remarks.
Wow. Well, dear Chair, distinguished members of the ENVI Committee, I want to thank you. I want to thank for this hour and a half of very intense, very fruitful, and very also scientific discussions. And discussion is always good, because I said I want to improve also communication and cooperation, and also the communication here in this very important political institution is important for directors of the European agencies, because this exchange of different views, of different political directions, but also scientific directions is very important. And we need this. We need arguments and counter-arguments. And the Parliament is the room where you debate and discuss. Not just do like this, but discuss. And I'm very happy that today we had a very fruitful discussion. And well, building on this, I'm very convinced that we will have fruitful cooperation in the future regarding the health of the Europeans, together improve the health of Europeans, to put public health high up on the political agenda. That we will do our utmost to do this. And I'm looking forward to really working not only as a director at the ECDC, but also in collaboration with the European Parliament, and in particular with this important ENVI Committee. And I'm looking forward to meeting you all again in, I guess it will be after summer, some of the ENVI meetings. And yeah, I wish you all the best for the upcoming election. All the best. Thanks a lot.
Thank you. Thank you very much. And some MEPs will come back, others will not. That's up to the voters to determine that.
That's democracy.
Exactly, exactly. No, thank you very much. That concludes now the exchange of view we were having on this topic. After the official ENVI committee meeting, the coordinators will reconvene and will come up with a recommendation on your candidacy. That brings me to the closing remarks of this meeting. Any other business is on the agenda, which we do not have, so that's easy. I'm just pointing out that the next meetings of ENVI will be on the 9th of April and on the 18th of April. And those will be the 2 last